930,000 people, and we have also refined our procedures and processes. So we work tirelessly to fight out the different links. In the meantime, we have coordinated efforts from different government agencies to place those asymptomatic cases and suspected cases into quarantine. In the meantime, we have optimized the arrangement of the doctor team. We also take great efforts in preventing hospital-affiliated infection. Currently, we are building the third makeshift hospital, and the Sanya Traditional Chinese Medicine Hospital is now regarded as a yellow code hospital. Different containment measures have been optimized according to the requirement of the provincial government. We are doing a better job in containing the epidemic control. Starting from August the 9th, the S10 highway and S9 highway, they would be put into a restriction status. Emergency vehicles could still have a pass. And we are pulling strengths together to fight the pandemic in a collective manner. A number of notices have been issued immediately after the outbreak. Different resources have been mobilized to fight the COVID-19 pandemic. Emergency supplies have been flowing into the city from all corners of the country. Everybody is working in solidarity in fighting the COVID-19 outbreak. Apart from those people who are working on their posts, most of the cadres at the grassroots level, and they have been dispatched to different community levels. And we also have dispatched more than 1,000 cadres to the community level as of August the 8th. We have mobilized more than 7,100 volunteers to the front line. From outside the province and outside the city, we have attracted more than 4,000 volunteers and medical doctors. What is truly incredible is that some of the travelers held up in Sanya, they have volunteered to fight the outbreak in the front line, and we believe that the people is the most powerful, and with the understanding and cooperation and participation of all the people, we have every confidence to claim the final victory against this round of outbreak. We're going to provide considerate heartwarming services for the people. In the immediate aftermath of the outbreak, we have taken some contingent measures to meet the supply needs of the consumers. The different supermarkets are working in pairs with different communities, and we have delivered supplies to the doorsteps and without any obstacles. Our COVID-19 containment people, they deliver some services as well. For example, the provincial post office, they have collected some commonly seen drugs, and they deliver that to people's doorsteps. Some mutual help platforms were established to ensure the delivery of supplies. The International Affairs Office of the municipal government has helped some overseas nationals living in Sanya for their drug needs. So we're going to continue with those heartwarming services. Over the days, we have identified different risk levels and areas with medium and high-risk areas. Drug delivery service is now a public good that we have initiated. at different areas with different levels of risks, and I hope that you can all follow the official platform of information release and get yourselves informed of the latest policies. And with respect to the return journey of those tourists held up in Sanya, there have been special meetings organized at the provincial level. Sanya has been carefully implementing various policies. We have set up work teams to introduce different policies for different categories of tourists. While doing this job, we try to avoid the spreading of the disease to other places. And the return journey has been organized in a very orderly fashion. And as of this afternoon, more than 300 tourists they have been on board in aircraft on the return journey to Xi'an. And for those other tourists who are still held up in Sanya, we will deliver very good services and to accelerate the return journey of those tourists. Here, I want to thank you for your great understanding. And now, with respect to our next step, Sanya will follow the leadership of the provincial government and CPC Provincial Committee. We will put on ground those very strict measures. And we wish to claim the victory with all the solid measures. Number one, we're going to do a better job in NAT and also in epidemiological surveys. We're going to improve the different links and linkage points, such as sampling, testing, and reporting, result releasing. The sampling speed and testing speed to be accelerated so that the confirmed cases identified every day would be put into isolation or treatment right on a day. Coordination between different government agencies would also be enhanced. Our COVID-19 task force would also be strengthened to deliver high-efficient science-based solutions. In the meantime, we're going to dramatically enhance the synergy between different stakeholders, such as supermarkets, communities, hospitals. So this is all I have to say today. Thank you very much. So thank you very much, Mr. Luo. And now let's start the Q&A session. And before asking the question, please also identify yourself. Thank you very much.
您好，海南广播电视总台记者提问。我们关注到近日市委组织部发布动员令，号召全市各级党组织和广大党员投身到此次疫情防控工作当中。请市委组织介绍一下社会面动员的相关情况。
CPC Municipal Committee mobilizing all the people to get engaged in a fight against COVID-19. So can you tell me more about this? Thank you very much. And may I give the floor to Mr. Quan Yan, Deputy Head of the Organization Department of the CPC Sanya Committee. Thank you very much. In the immediate aftermath of this outbreak, all the cadres and party members have answered the call immediately, and they rushed to the front line and built a strong fortitude against COVID-19. Mainly they have done 4 areas of work. The first one is making solid comprehensive arrangement, different levels of party members and cadres. They shoulder up their responsibilities and rush to the front line. They have demonstrated their sense of responsibility. August the 2nd, the Organization Department of the CPC Sanya Committee issued an order calling for all the party members to come together against the COVID-19 pandemic. The cadres and party members, then they went to wherever the situation is the most challenging. the heads of party organizations and government agencies have been dispatched to the grassroots and the community level to fight the COVID-19 head-on. And the organization system of the party is now deeply integrated with the COVID-19 fighting mechanism, mobilizing the party members and cadres to rush to the front line at the community level and at village levels. All the enterprises, public institutions, and party agencies, they have answered the call immediately, mobilizing people around themselves to become volunteers, and they also participate in taking people's temperatures and in maintaining the order of the massive nucleic acid testing campaign. They are also working closely together with the cadres dispatched at the village level, and they have been working around the clock in fighting the COVID-19 at the front line. They are facilitating with drug delivery, the delivery of supplies. As of present, the city has dispatched more than 10,093 volunteers. We have 62 party teams fighting the COVID-19. And also we have designated more than 1,000 zones under the accountability of party organizations. Mobilized by party organizations, private enterprises have also responded very actively, and they have participated in a fight against COVID-19, providing all sorts of supplies. For example, the party committee of social organizations, and they have mobilized more than 200 volunteers, and they donated instant noodles, mineral waters, masks, and tents. 18 delivery companies have mobilized more than 100 party members to take the front line of communities and villages, coordinating with the transmission and transportation of supplies. We mobilized party members and talents within the party to actively take up 8 measures for 93 cadres who have acted very well and positively, and they will be given a promotion. Some of the activists of would-be party members are quickly designated or included as official party members. The front line of the COVID-19 is a testing field for the political traits and qualities and qualifications of our party members. And they are also a test field for the performance of our government officials. Activists who do well on their post as volunteers or as grassroots coordinators will be given a faster track of quickly becoming the official party members. And those who are not doing very well will be arranged with a conversation to dramatically improve their awareness of COVID-19 control and prevention. Thank you very much, Madam Quan Yan. Next question, please.
你好，中国新闻社、中国新闻网记者提问。想问一下，作为这个主城区的吉阳区，在疫情防控和市民游客的生活保障方面是如何安排的
How did the district meet the demand of the daily necessities of its residents? Thank you very much, and I will give it floor to Yang Hongjun, the district mayor of Jiyang. Thank you very much for your question. And Jiyang district is the hardest hit in this current round of COVID-19 outbreak in terms of supporting the residents and travelers, and we have taken the following measures. The first is to bring everybody to the nucleic acid testing starting from August the 2nd in 40 communities and hundreds of villages, and we have established 200 sampling sites. We have mobilized more than 1,300 doctors and over 1,000 volunteers, government cadres and soldiers and volunteers were deployed at the different positions and posts to ensure efficient sampling. To this day, we have completed 8 rounds of sampling. The second is to put in place containment measures according to the medium and high-risk areas designated by the municipal government. We have taken measures such as disinfection, sanitation at different sites, and we built a emergency NAT sampling team consisting of 250 people. Each and every day for those people with walking difficulties, and we knock their doors to take their samples at their doorsteps. We also bring those close contacts to makeshift hospitals, and those should be quarantined and isolated must be quarantined, and those with suspect symptoms must be transferred to a isolation hotel. And also we have to we deliver support to the residents and tourists. We have set up medical teams to take care of senior citizens, pregnant women, persons with disabilities, as well as those who are in hospital. As of present, we have served 499 individuals, taking care of their personal needs, and the personal needs in general is collected and summarized at the village and community level. Should they have any needs of drugs, their needs would be reported and submitted to the task force, and we will deliver drugs to them. In terms of beverage and food, we have worked together with a couple of teams to deliver food and drugs to those people in need. In terms of drug delivery, we have focused on, for example, diabetes and high blood pressure drugs. In the meantime, we are strengthening our efforts in routine measures for COVID-19 control. Also, very importantly, we have set up a lot of WeChat group to identify the needs of supplies by working together with 37 food markets. We have met the needs of supplies by the residents. For high-risk areas, our working staff will deliver the necessities to their doorsteps, and for medium-risk areas, and the property management people and volunteers will deliver the goods to people's doorsteps. And going forward, we're going to continue to consolidate the measures introduced to put various measures on the ground and to do a good job in supporting the needs of our residents. Thank you very much for your question again. Thank you very much, Mr. Yang, for your answer. Next question, please.
各位领导，人民网提问。然后的话，这个主要想问一下咱们市卫健委的领导。
So my question is directed to the Municipal Health Commission. So can you give us a general introduction about the hospitalization of confirmed cases? What is their treatment going on? Are those confirmed patients? Are they in good shape? Well, thank you very much for your question. And the Deputy Party Secretary Zhan Cai of the Sanya Municipal Health Commission will take your question. All right, thank you very much for your question. And now let me tell you the hospitalization of the confirmed cases. In Sanya, we have 3 designated hospitals for COVID-19. They are Sanya Central Hospital, Sanya No. 1 Makeshift Hospital, and Sanya Makeshift Hotel. First, regarding Sanya Central Hospital. So this hospital is a designated one for COVID-19 treatment. It mainly takes care of those severe and acute cases. As of August the 8th, we have 41 patients in the isolation area. We have 54 doctors. Sanya number 1 makeshift hospital was built in June. It is located in Jiyang Avenue. It has more than 1,800 beds, and this is a hospital mainly for those with mild cases and asymptomatic patients. We have 1,036 people currently in the hospital, and the third one is the makeshift hotel. Since the Omicron 5.1.3 has become prevalent, the cases increased dramatically, and we immediately transformed a hotel into a makeshift hospital. Currently, it's accommodating 388 patients, and we have 165 doctors in that hotel turned hospital. We are currently building more makeshift hospitals. For example, one near Poli has as many as 2,000 medical beds. It will be managed by a Hainan Provincial hospital. Another makeshift hospital would also have 2,000 medical beds. And currently, it's in a process of site selection. Let me tell you about the treatment. The Omicron BA 5.13 is a variant that we have identified in China. It's one of the first few cases of such variants. So mainly, this is featuring a lot of mild cases, mild symptoms, or asymptomatic cases. So that is why we are following through the 9th edition of the National Protocol regarding COVID-19 prevention and control. In terms of treatment, we're using a lot of traditional Chinese medicine, and all the confirmed cases and asymptomatic cases, they are in good shape. Thank you very much. To Zhan Cai. Next question, please. And with China Media Group. Starting from this afternoon, Sanya will transfer back those tourists who are held up in Sanya. Thank you very much for your question. Deputy Mayor Wu Dong of Sanya will answer your question. Well, it seems that there is a lot of concern on this question. As I mentioned earlier, the first batch of 125 tourists, they are on board an aircraft. They are now flying back to Xi'an. There's wide coverage on the media. And thank you very much for your support. So here, let me tell you more about the return journeys of those tourists held up in Sanya. We set up a task force for that, which is responsible for formulating specific measures following the principles of containing COVID-19, avoiding spreading of the disease to other regions. We are putting in place measures to allow orderly and smooth return of those tourists. If you are a tourist living in a hotel, if you are tested negative for 7 consecutive days, and over the past 3 days you are showing no symptoms of muscle pains or dry throat, you can take a negative result of the nucleic acid test and then embark on a transportation means to go back to where you come from. On a voluntary basis, we focus on senior citizens, pregnant women, kids, and persons with disabilities to board on the first batch of trains or flights back home. If the tourists are held up in a closed-off area, and they can submit their needs, and we will identify your needs and then transfer you outside the closed loop so that you can continue with your journey back home. And before you leave the Hainan Island, there are strict measures, of course, regarding the checking of your health code, the NAT results, and also your travel history. Senior citizens and kids who do not have a cell phone to prove their travel record, and they can make a commitment, and after that commitment is verified, they can continue with their return journey. After returning to their hometowns, they have to report to their local authorities and continue with a 7-day health monitoring at their homes. And before returning to the hometown, we advise our tourists to take the initiative to contact their own local authorities. But if you are a confirmed case or a close contact or secondary close contact, or if you live in high-risk areas, you're not advised to return to your hometown as of now, and we will continue delivering heartwarming and considerate services. And we will arrange and coordinate with the civil aviation authorities to come up with more flights to meet the needs of our travelers. As for the specific arrangements, we will disclose that to the society in a timely manner, and the relevant information would also be transmitted by the hotels which are accommodating those tourists. If you have any questions, you can also dial the hotline. With regard to the specific hotline number, please follow the official account of the Municipal Health Commission. Thank you very much. Thank you very much to Mr. Luo. Thank you also to your questioning. All right, this is the Q&A session. As you have heard just now, thanks to joint efforts from all sides, as of 4:38 this afternoon, the first batch of travelers have boarded on a flight back home because of COVID-19. They didn't have a good time on beaches, or they didn't quite enjoy the vacation. But let me tell you that we are shouldering up our responsibilities for your life and safety. Here I would like to say we welcome you on your next trip to Sanya. Sanya is an inclusive city. It opens big arms for any and all of the tourists. This is the southernmost point of China, and when the epidemic is put behind us, you can come here again for the beautiful beaches, seafood, coconuts. Last but not least, I would like to say thank you to all the government officials, to all the journalists, and also all the viewers who are watching this live. We're going to keep you posted with the latest about the COVID-19 through our different channels and platforms. You can stay tuned and rest assured that we will put this behind us. Thank you very much.